When using Elevidys 1.33 x 10exp13 vg/ml intravenous suspension, the medication is administered through a slow injection into a vein, as prescribed by the doctor. It is given as a single dose, and the dosage is determined based on the child's body weight. In order to minimize the risk of side effects, the doctor may also instruct your child to take another medication by mouth, such as a corticosteroid like prednisone, both before and after receiving Elevidys 1.33 x 10exp13 vg/ml intravenous suspension. It's important to carefully follow your doctor's instructions in this regard. After the injection, small amounts of the virus may be present in the child's stool or urine for up to 1 month. It's advisable to consult the doctor on how to handle and dispose of waste materials, such as diapers, for this period. It is important to strictly adhere to the prescribed dosage and follow the doctor's advice for best results. If your child experiences vomiting, nausea, fever, or any other side effects, it's important to inform the doctor or pharmacist. This medication has been prescribed because the doctor has determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. If your child experiences any serious side effects, such as signs of liver disease, easy bleeding, unexplained muscle aches/weakness, or difficulty swallowing/speaking, it's important to notify the doctor immediately. Seek medical help right away if your child experiences very serious side effects, such as chest pain or shortness of breath. While a serious allergic reaction to this drug is rare, it's important to seek medical help if your child shows symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before giving this medication to your child, it's important to let the doctor or pharmacist know about any allergies they have. This product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your child's medical history with the doctor or pharmacist, especially if they have liver problems or a current/recent infection. Delandestrogen moxeparvovic may make current infections worse, so it's important to keep your child away from anyone who has an infection that could easily spread. It's also important to talk to the doctor if your child has been exposed to an infection. Let the healthcare professional know that your child has received this medication before they have any immunizations/vaccinations. It's also important to avoid contact with people who have recently received live vaccines. Before your child has surgery, it's important to tell the doctor or dentist about all the products your child is using, including prescription drugs, non-prescription drugs, and herbal products. This medication is not typically used by adults and is unlikely to be used during pregnancy or breastfeeding. If you have any questions about this medication, it's important to consult your doctor. When using Elevidys 1.33 x 10exp13 vg/ml intravenous suspension, it is important to be aware of potential drug interactions that could affect how this medication works or increase the risk for serious side effects. It is recommended to keep a list of all the products your child uses, including prescription/non-prescription drugs and herbal products, and share it with the doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without the doctor's approval. This will help ensure the safe and effective use of Elevidys 1.33 x 10exp13 vg/ml intravenous suspension for your child. If someone has taken too much of this medication and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911. Otherwise, you can contact a poison control center for further guidance. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to your provincial poison control center. Before your child starts receiving Elevidys 1.33 x 10exp13 vg/ml intravenous suspension, they will need to undergo lab and/or medical tests, such as liver function and complete blood count. These tests will also need to be done after your child receives the medication, so it's important to keep all medical and lab appointments. It's also important to note that after receiving this treatment, your child will not be able to donate blood, organs, tissues, or cells. In terms of the optimal timing for taking this medication, it's best to follow the dosage and schedule prescribed by your healthcare provider. Be sure to discuss any concerns or questions with your doctor. Elevidys 1.33 x 10exp13 vg/ml intravenous suspension is used to treat a certain type of genetic mutation that causes a lack of a specific protein in the body. This medication is given through a vein, intravenously, by a healthcare professional. The dosage is based on your weight, medical condition, and response to treatment. The medication is usually given once a month. It is important to receive this medication on a regular schedule to get the most benefit from it. This medication is typically administered in a medical setting, such as a hospital or clinic, and is not meant to be stored or used at home. It is used to treat a specific medical condition and should only be administered by healthcare professionals. The dosage and timing of this medication will be determined by a healthcare provider based on individual needs and medical history. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.